Thrombocytes, like these. Thrombocytes, now that's going to be the blood platelets. That's from megakaryoblast, give rise to megakaryocytes. These cells fragment to form blood platelets, which your platelets are extremely, extremely important in your body. And so right here, formed in a red bone marrow, pinched off portions of the megakaryocyte cell. Now again, be sure and look at this. Be sure and look at this thing right here. Be sure and have it available, because it will help you, and there'll be some stuff on your test from this right here. So be sure the top part of this sheet right here. All right, so there would be the megakaryocyte cell. Have no nucleus. Of course, they contain many granules, approximately 2. Now, if your platelet count, Shannon, if your platelet count is below 250,000 per ml of blood, they will not do surgery on you. They're going to get your platelet count up. Because if your platelet count's not where it should be, your blood won't clot properly. It will not clot properly. And here's an interesting thing that I've been involved in some is atrial fibrillation, AFib, where the atria are not doing it. They're doing, but they're not doing it. They're doing it. They're doing it, but they're not doing it like that. A little bit of this. Blood tends to pool in the atria. That's where the Coumadin regimen comes in. Now, Kimberly, if blood pools in the atria a little bit, they're going to put, remember the atria go, ventricles like that. Ventricles go this, atria go that. Now the atria, when they go into systole, they're supposed to go. If they do they kind of assle around, as my father used to say. If they kind of goof around, and they don't do it like they should, all the blood might not go from the atria to the ventricles. That's where Coumadin comes in, Brett. That's why they give people, heart patients many times, I want you to take 5 milligrams of Coumadin every day. Then I want you every week and a half to go in for a prothrombin time, PT time. Because if that blood pools in an atria, a clot can form, a little clot. That clot can go from an atria to a ventricle, and the first way out is the pulmonary. That can result in a pulmonary embolism. And they also talk about that blood, we're talking about these arteries, that little clot, going to the lung, getting back, but then getting into the carotid artery, going up the carotid, the left common carotid, going up into the brain, the circle of Willis and so forth, getting into the brain and causing, quote, stroke. And that's another thing they worry about in AFib. And so that's some good stuff. That's common. AFib. Any of you ever heard of AFib? Atrial fibrillation? Yeah. All right, but anyway, approximately of these platelets, that many per millimeter, that's per milliliter. And so there's the thrombocytes. That's just showing, that's off of Google there. That's showing you a blood platelets and a blood smear. And so there you see some platelets greatly enlarged. It doesn't tell us at the bottom. But there are the platelets shown there. All right, involved in blood clotting, obviously, lifespan 5 to 9 days, thrombocytopenia, that's the platelets. Obviously involved. That's why you take an aspirin, why people take an aspirin. Is to interfere with platelet blood formation, which we'll get into in a little bit. We're going to get to that today. Thrombocytopenia is a decrease in the number of platelets. Thrombocytopenia, I think that's on your, that's on that practice exam too. About the last, on that practice exam 2 or 3, look down at the very bottom there. Does it say a decrease in the number of platelets? A term for that? All right, decrease in, there's your answer right there, Shasta. A decrease in the number of platelets is thrombocytopenia. Remember that penia? Penurous means poor. It means poor, so thrombocytopenia means poor. So there that is right there. Plasma, very briefly, I'm going to go through this quickly. Components of plasma, water. Okay, no big deal on that. All right, most of it comes from the GI tract, most of the blood plasma. About 10% comes from cell respiration. Okay, plasma. Most of it's water. Okay, where does it come from? Most of it from the GI tract. Okay, that's no big issue. All right, now right here, I have your protein. All right, now right here, this right here is on your practice exam. Let me show you what's on your practice exam. Albumins produced in the liver, they do provide the blood with viscosity, and we also said the albumins transport bilirubin. We also said that the albumins do transport bilirubin in the blood. They transport bilirubin, say, from the liver to the intestine. The albumins will, or transport. Okay, so there's the albumins. The main thing about them, the albumins provide the blood with viscosity, do a little bit of transporting. Now the globulins, alpha and beta, now look at this. This is what's on your practice exam. They transport proteins that bind to lipids and fat-soluble vitamins. I had a girl yesterday, y'all. Didn't y'all listen to this question? She called me. I've had her name was Gamboa. Debbie Gamboa. She called me yesterday afternoon. I was about noontime. She called. She said, Mr. Westmore, how are you doing? She's in LVN school. And here was her question. She said, we have a question. I just have to get this answered because it's on the paper. It's on something that we're doing. She said, what did you say about the absorption of fat-soluble vitamins? What's the idea? See, the fat-soluble vitamins are A, D, E, and K. They cannot be absorbed in the absence of fat triglycerides, fats. In other words, we cannot have a fat-free body, totally fat-free diet, totally. If we did, totally, had no source, if we did, we could not absorb fat-soluble vitamins. They're absorbed, they're transported in the presence of fats, like linoleic acid is one of them. They're transported. So I said that's what your answer is. Fat-soluble vitamins have to be absorbed from the gut, from the intestine, into the blood, in the presence of the transport vehicle is a fat. And so that was her, that lipids and fat-soluble vitamins. In other words, the alpha and beta are also going to transport these lipids. So that's in practice question. Anybody have that question on your sheet there? What does it say? It says what?
Plasma proteins that assist in the transport of lipids. And fat-soluble vitamins are...
And there's the answer.
Alpha and beta.
Alpha and beta globulins, right. All right, so there it is right there. Gamma globulins are also known as immunoglobulins. Or the gamma globulins, immunoglobulins are antibodies. And right here, see, gamma globulins are immunoglobulins. That has reference to, in other words, you have three terms here that are kind of synonymous. Antibodies, gamma globulin, immunoglobulin has reference to antibodies. Antibodies are produced, as you already know, from plasma cells. Be sure and remember that. And be sure you know that there's a horrible type of cancer. And again, it's all bad. Some is worse than others, but it's all bad. But there's a horrible type of cancer called multiple myeloma. Now, did I ask y'all if anybody had heard of that cancer in here? I did ask y'all that. Nobody had they? And this
Next door neighbor has.
Your next, yes, right. You told me the other day. Multiple myeloma is a cancer of the plasma cells. Keep me posted on that guy. Don't say I asked about it. I'm just going to be curious about that.
Yeah, I gave him your paper. I told you I gave him your paper on it.
Oh, you did give the paper. I wrote a paper on multiple myeloma. Yeah, good.
Yeah, he was.
I hope he didn't depress him too much.
No, I mean, well, it says a lot of stuff that, like the treatment that he's gone through, like they inject him with stem cells and stuff like that.
That I had in the paper.
Yeah, or they've done that to him. So
he's, wow. Yeah, well, I told y'all why I got interested in that. I tell you why I got interested in it? Yeah, I did. You want to hear it again? No, okay. No, the reason I got interested in it was this guy named Ben Cole. He worked for my father. He actually started working for my father way before I was born. And Ben Cole, his name was Darrell D., but he went by Ben, a nickname. And this was right before World War II. In about 1943, Ben went in the service in the Army. He made the D-Day invasion, June 6, 1944, survived that. Came back, worked for my dad in the business. And then he retired from the grocery outfit and went into insurance sales. Sold insurance, did quite well in it. Diagnosed a few years back, I lose count of time, probably 2005 or 26, 27 maybe, somewhere in there, somewhere along in there. Because this is 2010 now, so probably 2007. He was diagnosed with multiple myeloma. And I saw him in my dad's store at that time. Our store, I hadn't sold it to Brookshire Brothers yet. At that time, and he was in there one day, and I saw him, and he normally stands this tall, and he was about this tall, and I said, what's going on? And he explained to me, he said, well, I've got a condition they call multiple myeloma, but it's going to be all right. I'm undergoing treatment, chemo and radiation. No. So the plasma cells, with multiple myeloma, the plasma cells, the cancer activates an osteoclast activating factor, which causes bone loss all over the